Wonderful. So, welcome again. Thank you so much for joining us today. This is another one of Wellspring's Be Well Talks. And so, today's webinar is on optimizing your health and well-being with the mix of six. So, if we could have the next slide, I'm very excited to introduce our speakers for today. So, we've got Dr. Lorenzo Cohen and Alison Jefferies here today with us. So, Dr. Lorenzo Cohen is the Richard E. Hines Distinguished Professor in Clinical Cancer Prevention and Director of the Integrative Medicine Program at the University of Texas MD Anderson Cancer Center in Houston. He is a co-founder and past president of the Society for Integrative Oncology and the former vice chair of the Academic Consortium for Integrative Medicine and Health. Alison Jefferies is a nationally board certified wellness coach, author, and educator. She has degrees in both art history and education, along with a master's degree in educational psychology, and has worked extensively as an educator. So thank you both so much for being on with us today and for agreeing to be a part of this webinar. We really are looking forward to hearing all about the wealth of knowledge you have to offer. So I will hand it over to you both.
Thank you, Vineta, and thank you for the time and effort that you put into organizing this webinar and for everything that Wellspring does. Both Alison and I hail from Toronto originally, even though we're now down in Houston, Texas. We both grew up in downtown Toronto, and I, in fact, started my cancer career with a National Cancer Institute of Canada postdoctoral fellowship grant and worked at the Toronto Hospital, Princess Margaret Hospital, way back in the 90s. So it's great to be able to share with this group. And I will let Alison, we're going to go back and forth throughout this talk. We usually like to be physically in the same place, but I'm actually in Toronto at the moment, and Alison is down in Houston. So, but our way of sharing this knowledge base that we hope will be very useful for you all is to have me provide a bit of the science, and Alison will be providing a bit of the how-to. And I'll let her say a few words about us and our backgrounds.
Hello, and thank you so much for having us today. Lorenzo and I are very excited to be with you. So how we got started, we're husband and wife and parents of 3 children, and we started making changes in our life when we had kids, and we realized that Lorenzo was coming home with all this information from his job, the research that he was doing and colleagues around the world were conducting. And we realized that there was really a lot that we could do to fill the toolbox of our children. And so we started making changes with them around what we call the mix of 6, which we're going to go into, and then realized we weren't making those changes. And we started making those changes with a group of friends, and realized that we had this wealth of knowledge, the science, and then how to do it, things that have worked, things that hadn't worked. And we decided to write a book together, and called Anti-Cancer Living. And this book is, just for your knowledge, is available in multiple languages. And it's really about making a body that's inhospitable to cancer, regardless of whether you've received a cancer diagnosis. What can you do to actually reduce the risk of recurrence and strengthen your body if you haven't had a cancer diagnosis? And so the day that we submitted our final draft, ironically, Lorenzo was diagnosed with a cancer. And so we went from educator, scientist, husband and wife, mother, father, to cancer caregiver and cancer patient. And, it was it allowed us now to see this situation from all sides. And we really doubled down on what we knew worked. And we took on the mix of 6, And, I helped Lorenzo embark and strengthen all of those areas as well as myself. And there was a lot of learning that went on. So we're looking forward to sharing some of that with you today.
So there's some very good news on the cancer front to be able to share, which is that there is, as you can see here, a really substantial reduction in the overall cancer death rate over the past decades. And this is really because of the phenomenal advances that we've made in treatment. And in particular, you can see here just this 1 year drop from 2017 to 18, the largest drop in 1 year, essentially ever, in cancer death rates. And that's primarily due to the discovery of immunotherapy. And Jim Allison, who's actually at MD Anderson, won the Nobel Prize along with a Japanese scientist. And I benefited from this myself because my cancer diagnosis was of a stage 3 melanoma, which was, really prior to the advent of immunotherapy, a pretty dismal prognosis, and the probability of it essentially having a recurrence after surgical removal was extremely high. And now it's been over 6 years, remain cancer-free and feeling better than actually at any time in my life. The more concerning news, and these are statistics from the United States, but really reflected in Canada as well, that this will be the first time ever predicted in 2025 that more than 2 million people in the US will be diagnosed with cancer, with over 600,000 deaths. And over the next couple of decades, we're really going to see a substantial increase in cancer cases and cancer-related deaths. And this is true around the world, in particular in low and middle income countries. But what we're seeing also on the flip side of this is the knowledge base that we'll be sharing with you today, that the majority of cancers and cancer-related deaths could actually be avoided through changes in lifestyle behaviors. And although many of you on this call today, like myself, already have cancer, these factors, as we'll share, will influence the probability of not only feeling better and thriving for the rest of our lives, but decreasing the risk of recurrence of disease or even progression of disease, and turning cancer, for those with an incurable disease, into a chronic illness. And this is, a very strong, very large number, strong statement and large number, that nearly 70% of lives lost due to premature deaths from cancers globally could actually be averted through effective risk reduction and getting people the appropriate treatments. Now, the area that's of most concern is actually what are called these early onset cancers. And I don't know the ages of the individuals on this call. In my case, it technically probably wasn't an early onset cancer, even though I was, in my early 50s. 50 and under is an early onset cancer, and in particular 40 and under. And we're seeing that now more than ever. And the American Cancer Society just released statistics last month, annual statistics that they release, showing now that women actually have 2 times the rate of early onset cancer as men. And this is being driven, of course, by breast cancer, endometrial cancer, and here you see actually the increased burden of colorectal cancer, where it's actually going down in individuals 65 and over, but going up both in incidence and mortality for individuals under 50. And the alarm bell has really been rung in this area. And you see a picture of what that looks like over time here, where, back in the 50s and 60s, essentially nobody under 50 was being diagnosed with colorectal cancer. And then just a few decades, the majority of colorectal cancers are now being diagnosed in individuals under 50. And if we look back at the American Association for Cancer Research and what they are saying, as well as others around the world, it's these factors that you see pictured here. And although some of these are harder to control, the chemicals in our environment, we'll talk about that as the last pillar of the mix of six. There are a lot of things that we can do to help to control what's going on.
So what is the mix of six? These are 6 areas that we've identified to focus on to try and create that sense of well-being and for your overall health. So social support, stress management, sleep, physical activity, diet, and exposure to environmental toxins. And so we're going to talk to you about what the science says in these areas, as well as some ideas of what you might do in your own life. And it's really important to remember that these are suggestions, and the key is to think about, does any of this resonate with me? Is this an idea that I could bring to my family? Because we know that cancer does not just affect the individual that gets the diagnosis, but it's really a family disease. And our families are there to support us and make these changes with us.
I'm not going to go too deep into the science, but it's also important to know the mix of six, of course, influences quality of life and how we feel and getting through treatment better. But it also influences key biological processes that are there to control cancer growth. And this has been put together by Hanahan and colleagues, essentially of what are called the cancer hallmarks, biological processes actually that are framed in a way that these processes need to be activated to allow that mutated cell to grow and thrive in the body. So we're constantly having cells, of course, replicate, divide in the body. Some of them will mutate and start misbehaving. We have all these processes that are there to keep that mutated cell in check, to get rid of it, either through the immune system or through spontaneous cell death, that you see pictured here. And the cancer hallmarks essentially are a way for the cancer to avoid these processes. And as you can see, there's a lot of them on this slide, different biological processes. The part that's important to know, and I will just mention this in a couple of the examples, is that the mix of six influence some, or in some cases like stress and diet, all of the cancer hallmarks. So an unhealthy diet will activate the cancer hallmarks. A healthy anti-inflammatory diet will lead to better immune function, decrease inflammation, etc., trying to make, as Alison said, our body as inhospitable to cancer as possible.
So the idea is that while it can seem overwhelming to try and look at all 6 areas at once, that it's a process, small steps, and that creating a positive contagion. So when it's not just diet, it's diet and all these other areas together can create this contagion, which allows you to be more and more successful. So the whole is more than the sum of the parts. Also really important, no matter where you are today, however you've arrived at this webinar, blame, shame, guilt, leave those behind right now, because super important to be where you are and to take that small step that you're interested in taking, that feels right for you to take, to gather this knowledge and to see what it is that you would really like to do. So starting and sustaining, this is the hardest part, right? Taking those first steps and making sure that you actually can do that. So that's what we're going to talk about today. The most important place to start is core values, because a cancer diagnosis elicits a lot of fear. And it's certainly a push to make the change that you're looking to make to be healthier. But it is actually not sustaining. What you need to come back to are their core values. And so the why of why you want to be healthier. So what are core values? The things that are the most important. If I were to ask you, what are the most important things in your life? You know, the things that you try and live by, the things that, you know, anchor you. These are some of the core values that my clients have shared with me when we have done this work together. So family, contributing meaningfully, friendships, faith. So identifying, if you were to take some time, maybe after this webinar or sometime today, to think about what are my core values and how do the changes that I want to make relate to those core values. So if I want to spend time with my family, because this is really something that is very deeply and important to me, then, you know, if I exercise, then maybe I can spend more time with my grandchildren. I can be more active with my children. So it's linking your core values to the change that you want to make. The most important and the starting place, and the reason that we put social support at the beginning of the mix of 6, is because without this, it's very hard to be successful. And often we set ourselves up for failure. So in our book, we say support is the backbone, which all other lifestyle changes will either succeed or fail. So we all know and can relate to, okay, tomorrow I'm going to head out to the gym. I'm going to start my exercise program. Then somebody's birthday is at work and there's a cake there. And then people are going out after work. And suddenly, you know, you don't get to the gym. You start eating food that you wish you hadn't. And you get into this cycle that feels very self-defeating. And so what we really want for everyone is to be able to back up and set up a support system before you make that first step.
And what Alison just described is actually what we would consider the indirect effects of social support, how social support can either hinder or ideally help you maintain those lifestyle changes and stay on track. But there's clear evidence that social support, social connection, and in this study that you see pictured here, the flip side of that, right, loneliness and isolation are key predictors of health and well-being. And this is the study you see pictured here of over 3,000 cancer survivors, and they controlled for all the usual things in terms of, you know, stage of disease and sex and marital status and even diagnosis of depression. And they found that the loneliest individuals had a 60% higher chance of mortality. And you see pictured here almost this dose response effect here. Those who were the least lonely had the best survivor outcomes versus those who were the most lonely, and the ones in the middle falling in the middle there. This is just one example of hundreds of data points on this factor that those who have more social connections tend to live longer. And there's lots of reasons behind that from a social connection perspective, but there's also evidence to suggest that there's key biological factors going on when we're connected to other people. And this is a very new paper, and I'm not going to go through the details here because, as you can see, it's a crazy amount of data that's super hard to understand. But they looked at over, you can see here, 40,000 individuals who were part of this large database, what's called the UK Biobank, and actually able to look at things like loneliness and isolation, and then what's going on gene-wise within the body. And they actually see that genes linked with inflammation, the immune system, were, let's say, misbehaving for individuals who had high levels of loneliness and isolation. So increase in inflammation, decrease in the ability of the immune system to function properly. And they were able to layer that onto different diseases like cardiovascular disease, stroke, and all-cause mortality. So it's not just that, you know, you have somebody to support you through challenging situations and to motivate you, as Alison will describe shortly, but it's actually having an impact on the key biological processes the cancer hallmarks, making our body inhospitable to cancer?
So it takes a team, and one person cannot do everything. With Lorenzo's cancer diagnosis, I could not do everything. I needed help, and I needed a team to help me. So who do you need to pull into your team? And evaluating where you're weak and where you're strong. So you have your healthcare professional, you have your MD, you have your doctors who are helping you manage things, a nurse practitioner, you have dietitians, etc., who give you expert advice on what you're going through. You also need people who can help run errands for you, do grocery shopping, do things that you can't get to because you need to focus on things that are more important at that moment. You also need to have somebody who you could take a class with, somebody who would be willing to step up and do online meditation. These are all very different kinds of people. And then lastly, you need somebody who you can share your deepest emotions with. And often when we look around, people from work might be interested in taking a class. Your neighbor might be going to the grocery store to help you, really mobilizing those resources. And it's not just the person who has the cancer diagnosis that needs the team. The caregiver needs the team too.
And what's important to know, and people are often reluctant to reach out for help and support, is you are actually helping these individuals in their own meaning and purpose and well-being. And there's evidence to suggest that supporting others and volunteering is actually salubrious in nature as well. And those who are engaged in more what's called eudaimonic behaviors, behaviors that align with meaning and purpose and supporting others, that actually has a beneficial effect on our biology. So you may think, oh, I don't want to bother other people. They have busy lives. You're actually giving them a gift by allowing them to help you. So it's important to keep that in mind as well.
And I was just going to add to that, that we, when we want to help people, we sometimes need direction. So, ask another person, get a list of the things that you need and ask a friend to, to sort of relay that to the group, your community, who are interested in supporting you.
So the next pillar is stress. And of course, the flip side, the ideal is stress management. We know that stress can wreak havocs in our body. We know also that stress is, as we write in Anti-Cancer Living, really the saboteur of all our healthy intentions. When we're experiencing chronic stress, it interferes with our sleep, it interferes with our relationship, it actually changes the way we metabolize food. And has a propensity to lead to inflammation, even from foods that are purportedly healthy for us. There's also clear evidence, and this is just one example. Now, you can see trying to choose papers that are very recent, even though we could go back 2 decades of research clearly showing that chronic stress decreases the ability of conventional cancer treatments to work well. But this is the most recent publication published in a very important medical journal, Nature Medicine, looking at, me, advanced melanoma undergoing neoadjuvant immunotherapy. This is exactly what I had. And they asked the patients about their stress levels before they started treatment. And then at the time of surgery, looked at who had a pathological complete response or a partial response or no response to immunotherapy. And here you can see the individuals who had low levels or no emotional distress. Of course, everyone has some level of distress, but this is, on a continuum, had a much higher probability of having a pathological complete response as well as a partial response. And you can see here the individuals who had high levels of emotional distress going into surgery less than half of them had that pathological complete response. If we track this over time, we also see that event-free survival was worse for those with distress, relapse-free survival, as well as having distant metastasis-free survival. Almost a 20% difference there you can see between those experiencing emotional distress and those not. And again, this is just one example. There's really a half century, to be honest, of research clearly showing that in particular chronic stress will get into the tumor microenvironment that you see pictured here, where cancer is growing in the body, and make it hospitable to cancer growth. Chronic stress activates, and I can't overemphasize this, all the cancer hallmarks, making our body more hospitable to cancer growth.
So here, your mother and I are feeling overwhelmed, so you'll have to bring yourself up. If only we could step out of that role for a little bit. So we can't really avoid stress. And the issue is, how do we deal with it? What can we do to take on? What kind of mind-body programs could we start and incorporate into our lives? So cognitive behavioral therapy, which is a gold standard, and often we need to circle back to some of these issues that we have carried with us for a long time, that potentially come from trauma or childhood. And in our book, a group of friends reached out and provided 3 sessions to another friend who was having a particularly hard time with a cancer diagnosis, and her husband receiving a cancer diagnosis. And 20 years later, she's still seeing that therapist, and it has really been a lifeline for her. Support groups like Wellspring, right? This is a great support group, and being in touch with people who are going through the same thing. Journaling, finding gratitude in your life, yoga, Tai Chi, Qigong, meditation, breathing, emotional expression, and expressive arts. And so how do you bring this into your life? One of the ways we did this when our kids were young was that we meditated every morning on a pillow before school. The kids were screaming and yelling, but we would sit down and we would meditate from 2 to 11 minutes each day. And it was a way of introducing them to this. And I could actually see the stress of getting ready and whatever they were carrying kind of draining from their face, their body finding that moment. And it has been a tool that they've been able to take with them as they have grown. Yoga, we also decided, hey, let's do family yoga so that we can all learn how to do it. And we took advantage of that. So there are all kinds of things that you can bring into your home, include the people who live with you and choosing a meditation online. There are so many different ones. Asking a person at work, hey, are you interested in taking this course? We've both, expressed that we've never done it before and want to. So really thinking, how am I going to reduce my stress, and what am I willing to do and will work for me right now? SMART goals. This is really important, linked to those core values and you making a decision. Let's say you decide in 3 months, because you to make a SMART goal, which is something big, and it stands for specific, measurable, action-oriented, realistic, and timed. So when you think about making a goal for yourself and pick one goal, and you set the target of 3 to 6 months in the future. So a goal around stress could be, I want to meditate in 3 months, 5 days a week. And I want to meditate for, let's say, 12 minutes or 15 minutes a day. That's in 3 months' time. And so you would think that's specific, it's measurable, it's action-oriented, it's realistic for me. I could do 5 days. I don't think 6 or 7, but 5 sounds realistic, and it's timed. So what could be my first step? Well, I've never meditated before. I'm just going to go online in the next week or 2, and I'm going to set that date. So a week today, at 9 a.m., I'm going to go online and I write it in my calendar, and I'm going to research and find out and look at some of these online meditations. Or my first action step could be, I know my friend wanted to learn how to meditate together. I'm going to call her this week. I'm going to call her on Thursday at 3 o'clock, and I'm going to ask her whether she'd be interested in joining me. So you make very specific goals, you write them in your calendar, and you take these tiny steps so that by the time that you start to meditate, I have the social support that I need to be successful. I've researched it. I've really found something that fits with where I am in my life right now, and then I can take that step forward. And if you aren't successful, then that also is it informative as if you had been, because it says maybe I set the wrong goal. Maybe this wasn't the action step that I should have done. Maybe I need to back up further, or I need to go further forward.
And what's important to know in this area is it doesn't take as much time as we think. We always think, well, I don't have the hour to put aside, and this is typically the primary reason that individuals give for not engaging in the mind-body practices is that I don't have time. And actually, one of my grandmother, who was a yoga master, one of her students said to me, "We don't have time not to have time." And that time could be as little as 5 minutes, or as we talk about in anti-cancer living, these mindful moments. It could be 2 minutes. And what's interesting is, from a physiological perspective, is that there's this nerve that is innervated throughout our body that wraps around the bottom of our diaphragm, called the vagus nerve. When you do deep abdominal breathing, what are called belly breaths, this kind of yogic breathing, extending the abdomen out, you stimulate the vagus nerve. And by stimulating the vagus nerve, you're activating the relaxation response. You're creating calm in the body. And even if you do this for only 3 or 4 minutes, and everyone, of course, has 3 or 4 minutes multiple times throughout the course of the day, we typically go for our phone instead of engaging in the relaxation response and creating this calm.
And something also to think about is that trying it out, being an explorer. So you like the idea of taking 3 deep breaths. Try it before you get out of bed in the morning. I have a client who meditates before she gets out of bed in the morning. I also have a client who has set her alarm to take those deep breaths 3 times a day to just bring the level down. It actually helps you to be more productive and more focused.
Okay, moving on. Sleep. Is oversleeping a real thing? Well, unfortunately, it is too, but that's typically not our problem as a society. We're typically not sleeping enough, and too little sleep would be really what would be classified as less than 6. There's individual differences, of course. There's a sweet spot around 7.5, 8. Some people, it's fine to sleep 9. But anything, less than 6, and we start to see problems with overall health and well-being. We know that, sleep is the key time both for psychological and physical recuperation, but very importantly, biological restoration. It is critical for brain health, for cognitive functioning, where when we are sleeping in particular, and especially during deep sleep, is when our brain is colloquially cleaned, and the buildup of proteins, amyloid plaque, etc., gets cleared out during the sleep cycle. And sleep is so important as it relates to cancer that it's actually listed, sleep loss, as a probable carcinogen. And Alison mentioned earlier cognitive behavioral therapy in general, but the gold standard for helping with sleep issues is what's called CBTI, cognitive behavioral therapy for insomnia, a combination of talk therapy with behavior interventions. This study that I'm showing here is really fascinating because they wanted to see not what just the effect of CBTI was on sleep-related issues, but could treating a sleep-related issue help with cognitive impairment, because we know of the link between sleep and cognition. And so here you see this was a randomized trial, 2 different groups. Those in CBTI over time had improvement in insomnia, no real change in the control group. but we also see this increase in cognitive functioning, cognitive ability, as well as overall cognitive impairment. And statistically, they're able to show that the improvement in cognitive functioning worked through sleep and well-being. Sleep and well-being, of course, is also linked to multiple cancer hallmarks.
So I think that we can all relate to the yo-yo around sleep health. And what's really critical is creating a sleep routine that is smooth and consistent, because it allows us to have that great cognition. It allows us to decrease unhealthy habits. And so we think about it in two ways. What can you do during the day to increase your sleep health, and what can you do at night? So napping 20 minutes for most people, a maximum of 20 minutes. You can lay down 10 minutes to get to sleep, 20 minutes of sleeping, set the alarm and get up. Being outside and having sunlight in your eyes helps you sleep. Obviously, exercise and just plain walking is very helpful. Alcohol and coffee, we know that surprisingly, coffee has a long life in our body. And so if we're struggling with sleep issues, important to look at whether or not coffee is a culprit. Alcohol is a stimulant, and a sedative at the same time. And so we metabolize our alcohol in the middle of the night, and that can lead to waking you up. And so really important to try and limit that also, because it's a carcinogen. Eating too late and being too full at night, what can you do in your room to create an environment that really facilitates good sleep? Earplugs if you're in a noisy place. Eye mask. Lorenzo has this fantastic eye mask that is very comfortable and doesn't press on your eyes. Temperature, also something that is incredibly disruptive. Looking at whether or not you need to put the air conditioning on if you live in Houston, or the heating, bringing the heating down a little bit. Those deep diaphragmatic breathing, setting the stage before going to sleep, not having your electronics in the room if you can do that, or away from you, and deciding that the last 30 minutes before bed, I am not going to be on anything. But creating that routine, and really also creating that routine for the people who you live with. If you are living with children, you're teaching them how to have healthy routines for the rest of their life, or your grandchildren if they're coming to visit, and your partner, and discussing how critical that is to be able to cope.
Physical activity. We don't need to spend that much time on physical activity because everyone knows it is so important. Individuals who are more physically active have a lower chance of multiple cancers. It's estimated about 12 different cancers. The more you exercise, the lower the risk. This is just some examples of 5 different cancers. And you can see it's this dose response relationship, although it starts to curve off, which means that it doesn't need to be a high amount of physical activity. In addition to just being more physically active, independently, we need to essentially sit less. This is a somewhat complicated graph, but it looked at not just activity, it also looked at sitting time. And so here you see pictured the individuals who were the most inactive, and there was still an association with cancer survival for those who were the least sedentary, meaning just sitting less throughout the day. So even if you're inactive, you can decrease the risk of death if you just simply sit less, move more. And again, back to the cancer hallmarks and biological processes, physical activity deactivates all the cancer hallmarks. It decreases inflammation. It decreases the ability of the cancer to form its own vascular system. And there's both resistance exercises as well as the cardiovascular, more endurance-based exercises that'll have an impact on multiple biomarkers and metabolic processes.
So I'm sure you've all seen these figures before, but 150 to 300 minutes of moderate intensity physical activity per week, 75 to 150 vigorous. But even if it means, walking down your driveway and then building up to walk around your block, if you're in treatment, all of it matters. So as Lorenzo said, standing more and move. This is the goal and the ideal, but start where you are right now. So what are some of the things that you can do? uh, you want to work on raising your heart rate and building a healthy heart. So, can you walk? We used to dance. We would have friends over with our kids and we would dance goodbye. We would put on the music and we dance 5 dances together. It was super fun, a great thing to do with your family. The elliptical walker, is that something that you like? Are you close to something outside where you could climb a few stairs? Could you arrange an outdoor activity with your family instead of an eating related activity? So where you would go to the park and walk around, biking, swimming. My mother's in her 80s and she's doing pickleball now and loves it. Building weight resistant training. There are so many wonderful programs online that you can use, but also really important to get some guidelines maybe from your local gym or going and having a few sessions with somebody if that's within your means. Often the cancer hospitals have opportunities for you to take classes and to learn. So building that resistance and standing up as much as you can.
And so the area of diet, people tend to over focus on that area, and that's why it actually comes, 5 in the mix of 6, because yes, diet's important, but it's not more important than any other area. There are both the things that we should be doing and also the things we shouldn't be doing. We wrote this paper a couple of years ago, my colleagues and I at MD Anderson, looking at the link between excess sugar consumption and risk of cancer as well as progression of disease. It was a combination of preclinical, meaning work done in animals, as well as the epidemiological evidence. And the link between sugar and cancer isn't just because it is a source of calories that's going to have you gain weight, and therefore it's the link between obesity and cancer. There's clear evidence that excess sugar consumption causes inflammation in the body, and you see that mapped out here, changes energy metabolism, changes the immune system. These are all cancer hallmarks. So excess sugar consumption is activating the cancer hallmarks. And this isn't just the added sugar in the diet, it's a diet that has a high glycemic load. We also know, as Alison noted, alcohol is a carcinogen, and the newest guidelines are that to reduce your risk of cancer more, avoid alcohol. A carcinogen means a substance that causes cancer, and this is clearly something that should be avoided or reduced. We also know that our body is filled with microbes and bacteria that can either be unhealthy for us, or the flip side, they can be healthy for us, what is called the microbiome. And we published this paper now a couple of years ago looking at the link between dietary fiber and probiotics and how that changed the gut and how that was related to response to immunotherapy. I had the honor of being part of this team as one of the senior authors, right beside Jim Allison there, who you see won the Nobel Prize, and Dr. Wargo at MD Anderson, a melanoma surgeon, being the lead of this research. So what we were interested in doing is we collected dietary data from melanoma patients, and I was actually the head of the patient portion of this, and then ended up being a subject within my own study, filling out the dietary record, collecting fecal samples to be able to map the microbiome, And we asked patients, about what they were eating on a regular basis, as well as the use of over-the-counter probiotics. And all of the studies were recapitulated in animals where we fed them different diets, gave them probiotics or not, etc., did fecal microbiome transplants, etc. So if we look at the individuals who had the highest dietary fiber intake, we see, and what we're classifying as sufficient dietary fiber intake had a much higher probability of survival over time compared to those with insufficient fiber. What was surprising to us was that the use of a probiotic actually negated the beneficial effects of a high fiber diet that you see pictured here. The only line standing out on its own are the individuals who had sufficient fiber and were not taking a probiotic. So you may be scratching your head thinking, well, I thought probiotics are good and they make my gut healthy. The bacteria in probiotics are in fact healthy. The problem is it's too much of one or two, or even in the best case, 15 different bacterial species. But we actually need more than 100. So it's the diversity that's the key. And really the only way to create diversity is through eating a high fiber diet. And that isn't very complicated. Another study done at MD Anderson, published by Carrie McDougall Daniel, where they were interested in just seeing if somebody eats a cup of canned kidney navy beans a day for 8 weeks, what happens? So nothing else changed in the diets. This was a randomized clinical trial. And 1 cup of beans a day increased the diversity with actual shifts of the microbiome to be one that does not favor cancer growth. But of course, as soon as they shifted back to their standard diet, cut out the kidney beans, everything went back to the way it was within 4 weeks. Diet will influence all the cancer hallmarks. It is a critical area alongside the other mix of 6.
So sometimes I cheat and I'll have a lizard or two. Are we saying that you need to become a vegan or a vegetarian? No. But what we really want is for you to think about how you can bring more of this into your diet. It's not about saying that you can never have something again. It's really bringing more in, which then pushes out some of the things that are not as healthy for you. So one of the things when Lorenzo decided that he was going to become vegan and the rest of the family were not at that point, and it was really hard for me to figure out how to cook and how to think about it. And one of the things that I eventually sort of got comfortable with is that I would make the vegetables first. So a vegetable would be on half of the plate. And I used a sort of the salad or the lunch plate versus a big dinner plate as well to reduce our content. And so you're looking for half vegetables. You're looking for lean, clean proteins. What can I bring in? Lentils? Can I bring in beans? Can I bring in these kinds of healthy vegetables that you see here, right? Cruciferous vegetables. So things like Brussels sprouts, kale, right? Cabbage, broccoli. Can I bring in onions? What kind of mushrooms and berries and nuts and seeds? So all of these groups, what can I bring to my table? And then, what can I do to help? Who can help me with that? Can my kids clean the Brussels sprouts? Do I even know how to cook Brussels sprouts? So can I gather friends together to do new recipes? Looking at your day, 90-10 rule. 90% of what you eat each day is health sustaining and 10% is either neutral or depleting. So when I look at my day, what does it look like? What have I had for breakfast? Could I have oatmeal with berries and maybe a little bit of yogurt? That's a healthy start to my day. What can I have for lunch? Because so often we could have a bagel for lunch. We could have a bagel for breakfast, a pizza for lunch, and pasta for dinner. And we've had nothing that is health sustaining. I know we're running out of time. So
the last area, the environmental area, this area is very challenging and we know is linked with probably the early onset cancers as that data is going to continue to emerge. And this falls into 2 different categories: the carcinogens, things that we know cause cancer that you see listed on the left, and then the more challenging area, which are the endocrine disruptors. These are chemicals and molecules that are in the things that we put on and in our body that modify how our hormonal system is functioning. And a lot of cancers, breast cancer, ovarian cancer, endometrial cancer, prostate cancer, are endocrine-based cancers. And there is a clear link, for example, between BPA, high BPA exposure, and prostate cancer risk. PFAS chemicals that we see are also endocrine disruptors. Pesticides, this is a new paper just from last year showing that the exposure to high levels of pesticides is comparable to the risks of smoking. You're probably all familiar with PFAS chemicals, these forever chemicals that are in our water system. And finally, there is going to be better control of that, but there's a link between these chemicals and endocrine disruption in the body. And so it's really finally time that people are starting to pay attention to this to clean up our environment.
But it's very important to remember that this is not well regulated, if at all. And there are over 85,000 chemicals that are in use, and only about 8% have actually been tested. So a lot of what you find in all of your personal care products, you will, essentially being taking that chemical burden on. And so when thinking about your health, you want your body to be in its best possible shape to deal with, if you're in cancer treatment, that your treatment actually works. And so all of these chemicals add a burden. You can scroll through them. So, and thinking about everything that you're exposed to, right? Paint, cleaning products, body care stuff, food, what kinds of chemical, plastic, all of these things. Leaving your shoes at the door is a great thing to do. It's a very Canadian thing to do because you have been exposed, the shoes bottoms have been exposed to so many chemicals. Dry cleaning, there are now green places to do. Anything with a scent, unless it's come from a natural essential oil, is a chemical. And so thinking about that, right? The chemicals that you're exposed to out in the environment. It is challenging. BPA, they've taken out, but they've put in BPS. So it's really exposure, limiting your exposure, thinking about your exposure, and using the precautionary principle. This is where you think about, unless I know that this product has been tested and has been found to be clean and safe, that I will not use it. And so it's thinking about from the top of your head to the tip of your toes. I know that you may have seen the research where plastics are now, being found in the human brain, these small microplastics. So it's really important to think about, what can I do? What can I do when I buy products for my children, for my grandchildren, the products that I have in the home? There are many clean products. The best place to go for those are the Environmental Working Group, ewg.org, to find out what is safe and what is not. So that's your resource to look at all of this stuff and be able to make some informed decisions.
So one of the challenges in what we've just presented to you from this data from the mix of six is it's typically presented in isolation, and most of the research is done in isolation and not looking at both the negative synergy but also the positive synergy. So if you were to say to oncologists, how should I modify their diet? They may say, well, try and eat some more vegetables, but they're not going to give it a lot of priority because the dietary interventions that were done on their own were somewhat modest in terms of the benefits that they found. But here's an example of the concept of synergy. This was a very large, very expensive dietary intervention for women with breast cancer that had some benefit, but again, very modest benefit. And you see pictured here 3 lines of individuals who didn't change fruit or vegetable consumption and didn't change exercise. another line of who just changed exercise, and another line who just changed their diet. And you can see here by year 5, year 6, certainly all 3 of those lines are overlapping. No difference if you change just one behavior. But that line that you see out there all on its own are the women who changed both diet and exercise, where they had much better survival outcomes. And this is truly the concept of synergy. This is another what we call neoadjuvant study, where they took breast cancer patients and had them engage in a diet and exercise intervention leading up to surgery. And they see that the cancer had disappeared in 53% of the women who were in the diet and exercise group versus only 28% of the women. So this isn't just about feeling better. This is about having a real impact on the tumor microenvironment. So synergy is really a key factor here. And we just went through a ton of information, and hopefully we have a few minutes for the Q&A. But in our book, this is all laid out, very prescriptive in nature. We even have an appendix of the list of the food groups and an appendix for the list of the carcinogens, the endocrine disruptors, etc.
So when thinking about moving forward, what to strive for, figuring out that social support and making sure that before you take the first step, you have everything lined up for success, finding a mind-body practice, sleeping those 7 to 9 hours, figuring out what's going to work for you exercise-wise, what feels right and is going to work in your family, thinking about food with that 90-10 rule that we talked about, 90% sustaining health, and watch your environmental exposures where you can. So it's a practice, and the more you practice, the better you get.
So there's, as I mentioned, a lot more information in our book, Anti-Cancer Living, which of course is available where all books are sold. We also have a website where we try and publish an informative blog, a couple of times a month. As was mentioned earlier, Alison has her own wellness coaching practice for those who are interested in getting more support in that regard. And independent of whether you work with a wellness coach, just engaging in these types of platforms are so important, and being part of Wellspring Canada, very important. So we hope this was informative, and that you start anti-cancer living today and think about what your next step is. Thank you.
Thank you so much.